And I'd like to turn this back to June.
Thank you very much, Mercedes, for chairing the meeting today. And please welcome Dr. Brian McSheffrey. He will be providing a presentation for us on how to find reliable information during COVID. So Brian, you're up.
Yes, I better unmute. Okay, I'm just going to get this thing on myself. Okay, everybody got me? Let's go then to there we are. And there we are. We need to go backwards. Okay. Now, thank you very much for the introduction. As you can see, I have a medical background in this, and I also put down one of my credentials here as grandpa, because I've been grandfathered after many long years of paying into the Saskatchewan Medical Association. I've been grandfathered into some of their things on COVID, and I found them very helpful. So I'm going to be using some of that on this as well. As you can see, or if you don't know, was a pediatric hematologist, and on that, I had some things to say about studies, clinical studies going on. This is a quotation from Shakespeare, and if the pandemic seems like this to you, it seems like this to a lot of people. I think that it's really a very interesting time to be alive and to see what's going on with these sorts of things. There's so many things to learn about this as we go along into it. I'm going to look at some statistics because I think that that's one place where we can get some firm grounding in this and some credibility. I think that look at the sources of information. There are some sources of information that you may find useful. And then I'm just going to look briefly into the vaccines and where you might want to get one if when your turn comes up. Okay. Now, when I was in practice, I was actually one of the investigators in the Children's Cancer Study Group, which was a group of cancer clinics across North America who pooled the patients that they had with very tight entrance, and the variables were very tightly controlled, and putting that all together with a very sharp endpoint, which was either the kids survived or they didn't survive. So that was part of it. We were able to put together some very nice studies, and I'm very proud of our small contribution that we were able to make to that with this. We're now involved in one of the largest, well, probably the largest clinical study that's ever been done. We have all sorts of variables, some of them seemingly controlled by madmen, but there are some, of course, that can be valuable, and you can make some conclusions from them. The things that we're going to be looking at then are the death statistics of this because they're pretty well defined. If you look at the WHO, it has definite standards in reporting death statistics. And thank God I haven't had to fill out a death certificate for a long time. But these haven't changed over the 50 years since I was doing it. And for any of the countries that belong to the World Health Organization, then the statistics actually can be compared roughly, at least from one to another. So I think that's one of the ways that we can compare the statistics. The most meaningful results will be reported as statistics per million. And I'm going to try and bring up some of these statistics so that we can make some comparisons between countries and between provinces and see where Canada stands and where our province stands in this. For a number of reasons, of course, the statistics may not be that accurate. If we look at, for example, India today, there's a breakdown in their healthcare system, and the results out of there, at least, don't seem to be that reliable, but not because they don't want to do it, but because it just has a complete breakdown there. There's also, of course, political influence. If you look for North Korea, they don't have any. So those sorts of things interfere with what we're going to look at, which is the number of deaths per million. In order to try and get around that, what's happened is that they've used something called excess deaths. This is a comparison of the deaths that have occurred during the pandemic compared to deaths that have occurred during the previous years, usually up to 5 years, so that we can get some idea, about the COVID-19 deaths that have occurred. Also, we can get some idea about the excess deaths. For example, people who have died from cancer because they have waited too long for diagnosis, the people with COPD that have got COVID, and a number of other things, perhaps even the number of deaths that have occurred because of drugs overdoses. And we know that that has gone up in this time as well. How much of that can be attributed to COVID is a matter for conjecture, but at least this is something that gives us some idea about whether how the countries have really responded to this and get some judgment about that. In order to then have a look at whether we can trust what's going on from our governments and from our public health systems. The excess deaths are harder to come by, and I don't really have any statistics that I can tell you about for our provinces or the other neighboring provinces. Now, the other thing I would like to just draw to your attention is that this is almost entirely medical. I'm really not in a position to make much comments on the economic aspects of this. I suspect that we have a lot to learn in the coming years on that. And I also have no comments on the political actions that have taken place. And if I do make a comment, it doesn't necessarily reflect the opinion of the Saskatoon Council on Aging. So here are the places that I've taken most of my information from. I'm grandfathered into a nice little website that takes the coronavirus statistics from Johns Hopkins University. This is sort of the most often quoted source, concentrates on the United States. So it's better if you have other sources in order to look at some of these other things across the country and across the world. I like this website, started by an 18-year-old gives actually quite detailed information, better than the Johns Hopkins University. Um, the only problem is that over the last couple of weeks, he's not reported that fully on the Canadian provincial. So I don't know whether people haven't paid for enough coffee from him, but I'm really sad that I can't really rely on this too much anymore. Now, one of the few sources of excess death is The Economist. If you just put this into your Google search, this will bring up the excess death statistics. And I'm going to show you some of these statistics to see where we stand as far as our performance. Now, this is that second website, the one by the 18-year-old. And I've just taken a snapshot of this. We're looking at deceased per million over here as the thing that we're going to be comparing down here. And this is just some of the countries that came up. They're usually put in by the number of confirmed cases, which really is sort of a mixed bag when you come down to it. This is something that is actually much more solid than the confirmed cases over here. The countries in Latin America really got hammered. Indonesia, I don't know. I don't know what the sources are there. Czechia in Europe got hammered as well. South Africa comes out at this. The Netherlands, I'm kind of surprised. They're a little bit higher than I would have expected. And here's Canada. Not looking too bad in this sort of a array of countries that are presented there. So I think that when we look at this, if you want to take away any conclusions from it, is that Canada, I think, has not done that badly, although probably we certainly could have done better. This is the statistics, and unfortunately, as I say, these have not been brought up to date in the last couple of weeks. This is taken from about 3 weeks ago, and as you can see from the provincial per million, Ontario, actually not as bad as I would have expected. Quebec got hammered. Alberta, I would have expected it to be a little bit higher, but there it is. I'd like you to sort of compare us to British Columbia. Here's Manitoba. Manitoba's got problems. And here, here's Manitoba, and here's Saskatchewan. Now, as you can see, we're not doing that badly, except that remember that our province is spread out. We've got 2 small cities compared to the other places presented here. And I would have been happier if it was closer to this here. So we're not that bad. Now, if you look just south of the border, of course, we're much, much better than that. The statistics per million in North Dakota are up in the thousands, and the same thing for Montana. So compared to them, we actually have done not too bad. Okay, this is the excess deaths. Now, the red in here is the excess deaths, and the lighter the shade in these bars, the less excess deaths that they've had. For example, Mexico has been hammered, and that is what you can see in the death certificates as well. Places like Israel have had some excess deaths as well. South Korea is pretty good, but here's Australia, and there's been some excess deaths there. And we would have expected Australia as an island to be relatively better. Here's Canada. I was surprised. There weren't that many excess deaths in Canada. Maybe we're doing something right. Now, the rest of these, of course, are just have different timelines on it, and shows you that there is a problem with these sort of statistics. Okay, now the sources of information that I would expect people would be looking at. The news outlets, the ones that I got grandfathered to, uh, the items that were there appear in the Star Phoenix 2 days later. Okay, so these items are available, and I'm going to show you a movie to guide you through where to find them, because I find Saskatchewan Health really a website that's hard to deal with. Uh, Things like the CBC, uh, Global, Star Phoenix, BBC, these are sources that have editorial boards and are less likely to promote stories that contain false information. Government sources, I'm going to mention CDC here, the Center for Disease Control. It's in the United States, of course. Uh, it's sort of one of the world sources in this type of thing, and is also led by one of my heroes, Dr. Anthony Fauci, uh, but is something that I think you can have some faith in their reporting. Health Canada and Sask Health, once again, I think when we look at how our country has done, I think we can put some faith in the way our healthcare system is functioning, the public healthcare system. Public healthcare associations, Public Health of Association of Canada, that's a source of information across the country, and Saskatchewan Health Association. Now, the Physicians Town Hall, I began to wonder a little bit when I saw some of the stuff coming out of Regina as to what sort of information the political end of it was getting. And so I decided I was going to join this. I was able to, and I have been. Uh, I like this source because I think that the public health people are not likely to be trying to fool the docs. This is a by invitation only review that happens every week, and you get a different sort of feel from this as to what you get from the public announcements and what you get in the common press. So I'm going to show you how to get into that. Uh, and then I'm just mentioning this as something that you want to be fully immunized before you go into this, because boy, there is some stuff in here that uh, actually has some really false information that I think needs to be corrected. For example, there was one presenter there who presented Sweden as an example of why shutdowns don't work, and compared it to other countries such as Czechia and Belgium that didn't do too well. But what it didn't do was compare it to the other Nordic countries, and it's far above what happened in Norway, Finland, and Denmark. So if you go into this, then just be a little bit cautious. And this is the end of that quotation that I started off with, the tale told by an idiot, full of sound and fury, signifying nothing. So just have your immunizations up if you go into that website. Now, I'm just going to run you through how to get the information out of the Saskatchewan Health website. I've had trouble with this website, so and the people at the SMA said, we'll walk you through it because it's a little bit difficult to find. So what I'm going to do is just start this up, and there's some pauses in this. So here we should go. There we are. You just put in Saskatchewan Health Authority, and that's all. Don't put anything else in. And that brings up this. And down here with this black bar, go to Saskatchewan, Government of Saskatchewan website, and we've got our reopening web And I'm going to go back. That isn't what I expected. Sorry. No, this is, yeah, there we go. Sorry. Okay, here's where we're going to go here. Okay, just wait for a minute or so. And we go into the lists here. We go down this list to sorry. We go down this list to information for healthcare providers. I'm sorry if I use the pointer, it seems to go off. And then farther down on this to information for physicians. This is all public. We go down on the information for physicians to the physician town hall. And then they've got video recordings of this. And I'm going to go into the first one here, which should bring up the smiling face of Susan Shaw and the physician town hall from May the 20th. And this will present the whole of the May 20th town hall. And I'm not going to keep you on this for the rest of the session here, but I'm going to go on to the next slide. Okay, this is the reopening roadmap, and as you can see, we're already on step one, and step one is due to cut in on May the 1st, I understand, for these criteria. What I think of this roadmap, I'm really not going to make any comments on because it's something that's open to some conjecture as to whether this is just driven by vaccines and whether there should be other things in it. So I'm not making any comments on that. I'm going to go then to where to get the vaccine. The second shots, which is something that many of us have been looking for. Online booking has sort of shut down until they get the schools done. The drive-in and walk-ins are open for the age groups. If you wish to stand in line or sit in your car. I called my pharmacist with whom I kept good relations, and I was able to get my vaccine a week ago, and actually was able to get my mother-in-law in this afternoon. And boy, that built up great husband points, I can tell you. And if you need to know your nearest location, including the pharmacies, then phone this number. This is a website that's run out of Regina. You put in your postal code, and they then show you where the sites are close to you where you can get the vaccine. So if you're wondering where you're going to go for these, then give this, put this into your search on a text message, and it'll bring up these sites. Okay, that's all I have to present. I'll answer any questions if anybody has them.
You did so well, Brian. I don't see anybody putting up their hands for questions. So thank you so much, Brian, for presenting for us today. And I would like to welcome now Virginia Dakanowicz, and she's our staff member that one of the things she does is she develops and maintains our website. So she has been doing a lot of work on that lately. And we have a new website that she's going to show off.
Okay, and to find our website, you would just type in SCOA in your your browser address bar, the browser you use to open web pages like Chrome or Safari. Always wanted to use this tool. So the purpose of our, you can also Google scoa.ca and the result, it'll show up in your search results and you'll be able to find it that way as well. And so the main purpose of our redesign was to assist our users to find the information that they need, because we've got a lot of information and we need a better way to manage it. So it's built in the WordPress. It's a web creation platform. It's very powerful and it's also free. So that's, we'll start at the top here. So this is the header area. This is a search function here. You can type in whichever topic you're looking for, like caregiving, and then click this button and it will return some search results for you that it's found on our website. And there'll be some, you might not get many search results at the beginning because as we add more content, there will be more, more search results. And there's also a button to become a member. Click on here and you become fill out your membership form. And this area here is important. It's our social media channels. This is Facebook and Twitter, and this is YouTube. So this is also important. If you're interested in our videos, you click on here and it will take you to our YouTube channel. And this shows, you'll click this video. This shows all our videos, I guess, that we've ever made. So you can click on one of those and just watch the video. Let's get on that. And down here is our main menu or navigation bar. This takes you all around the website. So each one of these items opens up a web page that I'm sort of hovering over here, and some of them open up other web pages. And if you ever get lost on our site, just keep clicking the home button. That'll take you right back to the home page. So here's for an example. This is about us. So if you click that, it's being very slow today. There we go. So this takes you to About SCOA, and it's on this page that you can find those documents that June was referring to. This is our annual report from this year, so you can either click on this to view it, and you can also download it. This is the one from last year. This is the strategic plan, the same thing. You can just click on this link if you just want to view it, or you can download it. And this is the bylaws, the same thing. You can view or download. And there's also some other pages of interest. Publications, under here you'll find age-friendly reports, coming of age, the directory of services. So that's where all those are stored. And these ones are fairly straightforward. Contact us. We've got a donate button here. These are sort of sub pages. If you click on these, they'll take you to pages as well. You can always click on home and you'll get back to the main page. So this is sort of the main body area here. And these are organized into topic clusters. And this was to help our users find information faster and improve the user flow. And it's based on an analysis of some common searches that we have and the needs that people have to find our information. So this is an example. It says click here to register. So if you say you want to register for the Hub Club, so you click on there and you find Mayfair Hub Club, and all you'd have to do is click here to register, and that'll take you to the form, and you fill it out and you're done. So any event or program or class that we have coming up, you can click on that registration page, and that will give you instructions how to register for that. And these are basically take you to other pages where you can get further information. And this right side navigation panel, we want to make our donate button fairly prominent. So I put there's a donate here in our menu and also one here on the right. And this is an important page. It's COVID-19 resources. So here you'll find vaccine information right at the top. And then all the other information which we have gathered throughout all last year of resources for older adults. So that's an important page to keep handy. And this is our news feed. So these are blog posts that have been published. And there's also a button up here for news as well. So if you're looking for information, you know, there might be a blog post written about it. So you can look under here as well. This is an events calendar where you can also find out what's going on. And it brings up everything item on our event calendars, and you click on here and it takes you to another, the calendar posting. And this is a featured video of, so I usually put the coffee break videos up here. So this is the last one that we had. I think it was the May 12th one, the budgets with Bruce. So if you can also find some videos in here as well. And then moving down to this section, this section is highlights our main or our largest program. So Age Friendly Saskatoon. This goes to the caregiver website. This goes to the GlobeWalk website, and this goes to the Hub Club page on our website. And then down at the bottom is just our footer bar with our basic information and our Canada Revenue Agency number. So that's a very quick overview of our website. So this is a work in progress. So there's still a lot of work to be done on it. And if anybody has any questions or feedback or suggestions, you know where to find me. So that's it for the quick tour.
Thank you so much, Virginia. As you can all see, the website is a fantastic resource for you to use. And I encourage you to surf around in it. And it seems to run very smoothly now. So I'm very happy that it's being revised. And this comes to the end now of our program. So thank you everyone for attending today. And just look on our website for the upcoming events. We have a wine and cheese fundraiser coming up, and we have a Canine Good Neighbor event coming up, and the Hub Club event. So unless anybody has any last questions, I think we'll end for today and hope to see you all in the future. Bye-bye.